In our health report tonight, a trio of pediatric health organizations sounding the alarm on children's mental health, now declaring it a national emergency. Local mental health providers say they are seeing an increase in mental illness among children. WSAV News 3's Brian Ray joining us now with what experts say is contributing to the ongoing crisis.
Good evening, Ben. Data from the CDC shows 4.4 million children in the U.S. have diagnosed anxiety and nearly 2 million have depression. Experts say they are seeing more kids develop those conditions, namely due to the stress caused by the pandemic. The director of child and adolescent programs at Gateway in Savannah says more kids are seeking help for anxiety and depression.
It was hard for kids to watch their parents and their extended family members go through the pandemic. And now, even though they're back at school and things are getting a little bit back to normal, they still have, I think, fears about, I don't want to get anybody in my family sick and that sort of thing.
While stuck at home during the pandemic, many kids were spending more time behind the screen, another damper on their mental health.
What they see is everybody's living their best life, and then that has to beg the question, well, what's wrong with me? Because I don't feel like I'm living my best life. And, that's hard for kids.
We have been feeling this and seeing this throughout the pandemic.
Hillside's assistant medical director says the stigma surrounding mental health can prevent kids from seeking help.
Kids are in an age where they don't want to be different from their friends, and they want to be able to look towards the future. And so if they're feeling really sad or anxious, they will try to handle it in different ways and often cover it up.
If the problem goes untreated, experts say it can lead to something worse, like substance abuse. They say eliminating the stigma is just one part of the solution.
We take our kids to the doctor if they had a headache, if they had the flu, but we don't seem to have that same reaction if they're depressed, or they seem to have compulsive behaviors, or they seem to be anxious. But we should, because a lot of us are suffering from that.
Nick Fadden says some of the warning signs parents should be aware of include a change in eating habits or withdrawal from typical activities or people. She also says treatment looks different for every kid and can include therapy, medication, or even joining groups or activities. Brian Ray, WSAV News 3 on your side.
Brian, thank you.